we'll try to find out the proper location where the K1 points are the two locations. One location which already I'll tell you this. The second location is K1. You just take the deep breath. Yes, yeah. Now there are the two locations which I told you. Do you know where is the Chai-in? Chai-in is the UB67 acupuncture points, where it started and where it get terminated. It started on the Qingming, that is the UB1 point, and got terminated on the small pinky toe. There are the total 67 points. The 67th point is located on the lateral point 1 chun proximal to the lateral corner of the nail base of the pinky toe or the small toe. So UB67 completed in this region. Now the energy get converted to the kidney meridian from the UB67 to the K1 on the medial side of the pinky toe. One is the lateral side is UB67, the medial side to be known as a K1 point. So therefore the kidney 1 point on the nail base. Now this is as per the as per the traditional Chinese acupuncture, the energy started from this place. Then the energy is descending to the downwards direction, but that to be known as at this point, as per the principal meridian of the Chinese medicine, this to be considered as a K1 point. Now K1 point is great point to treat for the what conditions normally. Now try to find out here also location. Now midway between the second toe and then third toe, you just come down. This to be known as a metatarsal bone. These are the metatarsal bones, but between the second and third metatarsal bone, but now you can divide it into this, the web margins. From the web margin divided into three segments from here to the heel level. This is the 1/3, this is the 2/3, this is the 3/3. So in this way, this is the 1/3 point to be known as a 1/3 of the upper level, that to be known as a Yung Chuan, midway between the second and third grade toe, this to be considered as a K1. Now if you wanted to activate for the K1 point, but obviously you can use the 2 points at a time, or you can use it as a single time. However it is possible, we can do it. But however, as per the Chinese medicine, it has been proven that better you can apply on the sole of the foot, but the top of the foot, the prime point to be known as a Yung Chuan. This is as a lower portion. On the top heaven point to be known as a DO20, that is the Pai Hui. There is the earth point to be known as a, that is the K1. No doubt K1 is the wood point and also parent and child point. That means is the infant point or the sun point. So the sun point of the kidney meridian located on the earth level, this is the only the one point is located on the ground level, that to be known as a Yung Chuan, but no doubt some other point also located on the, based on the Taiwan acupuncture, there is another point 55.01, something like that. The point is located over this region, but however we can consider this Yung Chuan is the principal Chinese one acupuncture point. What exactly the specialization of this point? Remember, there are the numerous functions of this particular meridian, but you can recognize the K1 point is the topmost distal point for the brain. Anything is the brain related problem need to be activated, then what is required? The K1 need to be activated. I told you the C of the marrow to be taken place, brain of the marrow to be taken place by activating the K1 point or the kidney meridian. In that case, the distal point for the brain, that to be known as a K1 point, topmost lower distal point. So therefore K1 point to be activated for emergency conditions, but no doubt for the coma, drowning, shocking, sweating, perspiration, or any emergency conditions or the vertigo, giddiness conditions, obviously you can use this point as a K1. Obviously it's a good point. Second way, but whenever there is the constipation related problem, the patient don't feel the passing the stool, on that situation you can use the K1 point is good. When the constipation get clear, then the bladder also get clear, because this is the C of the lower orifices, there are the two orifices. One is the urethra, the second one is the anal region, both to be taken place by activating the K1 point. By the way, some of the emotional disturbances also get clear. The people who have the feeling of the fear complex or the low energy, or sometimes they feel as if to kill the people, but he have the tendency, that is the anxiety and also depression and some kind of the mania related problem, hyperactivity problem. When look at about the my brother, I wanted to kill him. Look at about the strange person, I wanted to kill him. The tendency is there, the temptation is there for them. Normally you can recognize who do the murder these days. Maybe they are taking the revenge of that any one person, or something connected to that emotional disturbance is also reason to leads to that problem. But they do have the mental related problem, they do have the psychological related conditions, could be the reason to cause some kind of the problems. Sometimes what happened in midway between, I wanted to kill myself, or I wanted to do the suicide myself, or I wanted to make them to suicide to somebody else. But in that way, when I wanted to suicide, that symptoms, that's the reason he take the blade and he take the some medicines, but he take the hypnotics and sedatives and cetirizine medicine to kill themselves, like that wise. But generally that particular tendency, they whoever they do have, even that condition also you can use the K1 point to bring down and to eradicate that condition. That one or other way will be good, because you are treating to the C of the marrow of the brain. That's the reason K1 point is a good point to treat for the all the suicidal symptoms. Sometimes what happen, one child is coming and he says that I wanted to keep the I kept literally blade. So blade is he kept midway between the teeth. I wanted to crush and I wanted to kill myself. So in that way they have he don't want to do, he know the pain, but still he have the tendency, I have to do like that. But he have that kind of the eagerness to do. Even that symptoms also can be subsided by activating this point. No doubt K1 point is the local point, it having the adrenergic effect, it having some kind of the effect to improve the adrenergic is nothing but is giving the lot of energy to the brain as well. So it improves the blood circulation to the brain. That condition obviously having the great results to enhance the brain function as well. Whenever there is a coma in the patients, they do have the hospitals, they says I have the problem related to parents, we say, or somebody relatives, they say I don't have this problem. Then recognize that you need to activate for them hemiplegia, paraplegia, or the coma conditions, unconsciousness conditions. You need to awaken this. But really I'll tell you, this is the great point. Once there is the some kind of the alertness is there in them, then you just activate, the leg will get shake. So leg get shake, that indicating the person is alive. Even sometimes people will ask me, please visit, my father is gasping, or maybe the person is alive, or maybe not alive, there is no breath is coming. We now need to see and identify the person is alive or not alive. Then you just apply the K1 point on the sole of the foot region, and then once you apply that, patient feel the pulling sensation of the leg, or maybe he may get reflect that eyes gets open. When the eyes gets open, the pupils are open. When the pupils are get changes, then the person is alive. Then we can recognize, yes, still is alive, please take care to the hospital immediately. Maybe the hypoxia, maybe hypoglycemia, or some other reason to cause this problem. Please you just take. Until that, you just activate. If the person doesn't have the needle, no acupuncturist on that situation, and the children or maybe in the parents are there, they are not aware of that needle insertion, please you just take the toothpick. Even you all, you don't have on that particular moment, then you just take the stick or toothpick or the pen or pencil, you just give the pressure rapidly like this, 1 2 3 4 5 6 7 8 9 10, you just activate, give the deep pressure. But obviously that also having the great impact, but not necessarily required 30 minutes you need to keep it this point, not required. But whenever the patient feel alertness, yes, is the consciousness within a minute or two, then you just pull the needle, remove the needle, and then ask them to relax themselves. Then lift the leg in the upward direction, as much you can lift the direction of the upward direction. So then obviously that goes the blood flow to the brain system. In that way we need to do in during the emergency conditions. By the way, this point is the sun point, that means it gives the energy to the the liver, because it is the wood point. All the food in viscera will start with the wood region. So therefore wood points is connecting to the liver. The kidney 1 is connecting to the liver, but K1 is equal to the Chuchuan, that is the liver 8 point. So interconnected each other, that gives energy to the liver. It gives supplies to the energy in the form of the blood to the brain and also heart to improve the overall health. So therefore this increases the K1 point to be known as a Shao-in point. But Shao-in is the heart to be activated with the support of the liver. When the heart is good, then the blood supply also good. In that way this will work for the numerous conditions, for the emergency conditions. Yes, obviously there is a tumor of the brain and also there is a clot or the hemorrhage, but hemorrhage cannot be successfully treatable by acupuncture, but obviously we require the medical intervention for emergency conditions. But however, there is a stroke and blockages, stagnation, any kind, such a kind of the problem, obviously that have the great impact to treat by using the kidney 1 point is useful to strengthen to the kidney. Remember, in emergency condition, there is a dysuria or there is unable to pass the urine. In that situation, patient, even yesterday I just applied, when the difficulty in urination, the urine flowmetry they have done, the flow is very poor. In that situation, the post-void and pre-void urination, after the passing urine, maybe the retention of the urine 20 ml, 50 ml, 100 ml, 200 ml is the retention is there. Already there is a retention is 400 ml, but passed only the 200 ml. Remaining 200 ml is existing in the bladder. That time is the post-void urination need to be activated. Then this point also really helpful for the prostate gland related problem, and also there is a burning sensation on the sole of the foot for the neuropathy conditions. For the diabetes mellitus and numbness feeling sensation can be activated. And further, there is no energy, there is a neuromuscular junction on the nerve endings, there is a poor connectivity, one neuron, the second neuron is, there is no connectivity, that time need to be activated. This will slowly strengthen to the nervous system as well. No doubt the neuron, one other neuron, there is no myelin sheath. The myelin sheath is electricity passes, but there is no myelin sheath, cannot be successfully treatable. But still for the mild to moderate level, there is a junction, only two is disconnected and slowly connect to the closer to this region. In this way, once we do it, but slow and steady, greater than 50 to 70%, patient will be all right for the diabetic neuropathic condition as well. Hopefully, whenever you wanted to treat, remember for the K1 activation, by using the 2 points can be treatable. One to be known as a opposite to the UB67, second point to be known as a this point, but this point is emergency point for the medulla, and also there is a pyramid of the kidney system as well, but indirectly it gives the support to the urethra as well. So hopefully you understand about the K1. Yeah, for half an hour you can keep it as a general way, but still you wanted to, in a specific condition, there is the unconsciousness, the consciousness come and immediately withdraw a minute or two, doesn't matter, that also quite enough. So hopefully you completed. Yeah, I just applied as a this direction is the tonification, but this also applied in the perpendicular direction, that to be, there is no much tonification sedation, but still you wanted to use as a perpendicular, you can use it. But as you rightly said, is the Dr. Woltz invented some of the points, but he invented, we do have the 27 points, maybe he says as a 38 points I believe, but in that case we wanted to use as a kidney K1.1, K1.2, 0.3, 0.4, 0.5, like that. Those points you need to activate for your condition, I just say you. But here some of the points, the kidney 1, 2, 3 points are existing. Give me the micro needle, because she is not the patient, I don't want to give pain over this region, I just apply the micro needles. So you just see that the another point to be known as a K1.1, but here is actually the point is started this also. You remember these are the 2 points also, good point to treat for the K1, right? This entire region inside of the pinky toe, where at the junction of the black and white skin, and then come down from here, that's called as a Pa Feng. Pa Feng is the extra 38 point, but these all the points, liver 2, that is a Xingqian, Niting, and then Xiaxi. This is Xiaxi means is the GB43, and then is the Zutungu is UB66. These are the entire points are the Pa Feng points, but we can activate till here the points to be known as a till here the points to be known as the kidney points, right, till the web margin. So now we start with the traditional Chinese points. That would be really better to activate. However, all these points are good point to treat for the kidneys activation as well. Now let